Hello, this is Dr. Renee Young of Young Naturopathic Center for Wellness. Today I'd like to talk a little bit about the difference between dementia and Alzheimer's disease. It's often that people think that the two are the same. That's actually not the case. Dementia is an umbrella term that just describes a set of symptoms. So when you say someone has dementia, it generally means that they have a slowed cognitive function, they may have inability to communicate, or even have slowed or lessened ability to perform daily activities. Whereas when someone's diagnosed with Alzheimer's disease, it's a very specific form of dementia, and in Alzheimer's disease, patients specifically have parts of their brain affected that have some level of change or deterioration that sometimes isn't reversible. So understanding that dementia is just a set of symptoms, similar to saying like you have a stomach ache or a sore throat, it just means you have something. It's not actually a diagnosis, is really an important part of getting your loved ones the right care. Alzheimer's disease, according to the Center for Disease Control, can be a reason for up to 50 to 60% of all dementia cases. Doctors will use a combination of cognitive tests, blood tests, and brain scans to determine whether or not someone has Alzheimer's disease instead of just dementia. So if you think that someone that you love potentially has one of these illnesses, the best thing to do is to get a line of communication open between you and your doctor. It's really important to find out what's exactly going on. For example, if you have a loved one that's just suffering from dementia, dementia can actually be onset by even something as simple as a urinary tract infection, which commonly happens in people as they age. They can become delirious, their communication can slow, and you may not even know why that's going on. So you're chalking them up to having a major illness when all they need is a simple antibiotic and a little bit of care, and they may come around just fine. So really determining the reason for memory changes is important. I'd also like to say, if you have someone in your family that suffers from dementia or Alzheimer's disease that's no longer with us and you're worried about your own risks and risk factors, there are things that you can start looking at now. So if you suspect that someone you love has dementia or Alzheimer's disease, getting the right care is all the world for this person. So please make sure that you get them to their doctor. If you think this information is of value to you or someone you love, please pass it on, share it, like it, send us your comments or your questions. This is a sensitive topic and we're always happy to talk with you. If you need some coaching around how to help yourself or how to help someone you love, feel free to call our patient care concierge. They're happy to set you up with a consultation to talk to one of our doctors today. As always, make sure that you're taking care of yourself and be well.
Thank you for watching. For more tips and free updates on how you can be well, please download our free special report, The 9 Hidden Reasons You Are Sick, Fat, and Tired at youngwellnesscenter.com.